Stay tuned for the next guest.
Dear viewers, we're back after this report, and in a new Kuwaiti medical achievement, a consultant otolaryngology, head and neck oncology, as well as facial plastic surgery at Farwaniya Hospital, Dr. Mishal AlMutairi invented a method for the first surgery in the world to remove stones in the parotid gland for a very rare condition.
Definitely, Rita. So, dear viewers, please welcome our first guest of the evening, Dr. Mishal AlMutairi, consultant at otorhinolaryngology, head and neck oncology surgery. Good evening, Dr. Mishal, and congratulations for this achievement, and we're really proud of you.
Good evening, and thank you all for this introduction and also for interview.
No, thank you so much for being here. It's definitely an honor for us to be interviewing you this evening. And personally, to start out, I really want to know about the surgery. So, doctor, tell us about the specific surgery and how it differs from the usual surgery.
Yeah, first of all, I wanted to say I wanted to dedicate this achievement to Prince Nawaf Al-Ahmed Al-Jabr Al-Sabah and Crown Prince Sheikh Mishal Al-Ahmed Al-Jabr Al-Sabah. And all Kuwaiti people. First of all, let's start with those cases, which is, you know, let's simplify it. You know, we have many salivary glands in head and neck. We have two major salivary glands, which is the parotid gland here, both sides.
Yes.
And also we have submandibular gland. I received one patient. This patient was referred to my clinic and, you know, referred as a tumor case.
Right.
Because at 16 years old, this is mainly some of them thinking about tumors, because usually it will not be stones. That's why they referred this patient to me first.
Yes.
And when I examined her, doing some clinical examination for her, and also doing radiological investigations and many tests, we found, you know, something rare, which is we found there is a parotid stones, and actually on not only one stone, it was two stones, one in the superficial part of the parotid gland, and the other one was in the deeper part, which means a deep loop of parotid. And you know, in this case, first at this on this age, you know, this is considered to be rare.
That's right.
But also two stones, it's more rarer. This is why it become look like, you know,
Both the age and the condition.
Exactly,
Right.
exactly, both the age and the condition, and also the family. They are worried, and you know, they think this is some cancer. First of all, we told them this is not cancer, inshallah. This is something will be benign, inshallah, and this is just stones, and we will deal with it. And the usual operation done for those, we have three mainly operations used on those cases. We use either cyaloendoscopy, which is scope, can be introduced to the parotid canal inside the mouth. You know, sometimes when you open your mouth, you didn't find anything, but there is a small opening, cannot be seen.
Yes.
And you can localize it by probes or something, and then you can put this. And this cyaloendoscopy was FDA approved in 2005.
That's great.
Yeah, and there is other method, which is the traditional one. They name it as an open approach, and this open approach, mainly they open a big incision outside the neck and on the face also, and then they try to remove the gland or remove the stones. In this case, you know, I was on challenge with myself.
It was really challenging.
Yes.
Definitely.
And then, you know, I told the mother and father, how can we approach it? But the cyaloendoscopy will not be a good option because the deeper stone is so big, irregular in shape, cannot be removed by cyaloendoscopy. So we have the traditional one, but we have also risk. Maybe you will ask
Right.
some questions or something related to
Yes.
this complications, but there is complications might happen
Of course.
during this
It
procedure.
was risky.
Yes, which is the facial nerve. We know the facial nerve is the nerve coming from the on the face and then branch to 5 branches, which is responsible for your muscle expression on the face. When you smile, when you even eating, it's control you. So, mother, she was upset because, you know, this young lady, or
Right.
let's say the young girl, she had a future,
Exactly.
and you know, I was in doubt. How can
Yes.
I do something?
Definitely. And I think that pushed you to really invent this new surgery, right? The
Exactly.
awareness of the condition.
Exactly. But before I think about it, I discuss my colleagues, because now in medical field, in my opinion, there is no man one show.
Right.
No, we have to discuss it, and also take opinions from the others.
Exactly.
Ask
So
the
important.
experts. Even you reach a highest level, but maybe some people they will help. So
Yes.
I discussed with the my colleagues, international doctors. They are experts in those surgeries, and they say this is very rare case. This is the first, and then I ask them how can we approach it.
Right.
They mention a lot of approaches, and they said difficult, even difficult. So the only things is to do traditional one, remove the whole gland.
Oh, wow.
And then I get upset because, you know, this is young girl. When you remove the whole gland, later on, I know
Yes.
there will be asymmetrical face for her,
Definitely.
and it will be, you know, anxious condition for her, because in the future she will think, or you made something for her, she will think a lot about it.
Exactly. And I think that's very normal for us girls, especially at that age, at 16. That's a very sensitive age for us. And our physical appearance, unfortunately, at that time is very important to us.
Definitely.
So I understand where you're coming from, doctor. So when it comes to the actual patient, I know usually patients are really scared of surgeries, no matter how big or small they are. And as you said, this was the first time the surgery is done, and it's a rare condition. So what happens with the patients? What is the details, and how long does it take for full recovery?
Yeah. You know, I think how can I minimize this incision? And also I have to be safe. So I put many targets. I have to reach all of them.
Yes.
That's why, you know, also patient, she was in severe pain because she cannot eat. And so I decide to go through an open approach, but with a small or minimum incision, and then dissect. So when you go inside, you have also to see what is inside. So I use scopes, which is usually we use it for nose. Will give you many degrees of views.
Yes.
So we dissect this area, and also before that we use ultrasound to localize the stones, and we put very, very small needles, because, you know, as I mentioned, facial nerve is there, and
Yes.
also there is some fissils, but we are lucky because ultrasound also can localize the fissils and the
That's
stones.
great. That's really
Amazing.
great.
Exactly. So I was thinking about this approach. And I discussed with the family, and I told them this is the first time. If you are agree, or if it's failed, we can go to the traditional one, we remove it. So the family, they are agree. And we go ahead with it. It was really nice. And it was done perfectly. And I was not in hurry even. We
Yes.
finished the surgery. You know, as we know, in medical field, there is complications. You should know, and you should deal with those complications even happen inside or intra-op or post-op. And there's complication. It can be intra-op, you should deal with it. Post-op, there is early complication and also late complication.
Exactly.
So I said to myself, I have to wait and see the final results even, because we finished the intra-op. And
Yes.
early post-op, facial nerve was intact, alhamdulillah.
That's amazing.
And also late complication, nothing happened.
Alhamdulillah.
And this patient now, she's happy, she's fine. And I wanted to congratulate her because she took 94% in high school.
Wow, that's
Yeah,
amazing.
that's
Well,
really great. A great
Mohammed, I
achievement.
think it's great, exactly.
Yeah.
And of course, Doctor, would like to congratulate you for
Thank
this
you.
great
Definitely.
achievement. And you really did look for all the details in the
done.
surgery, which I think is really amazing.
Yeah.
Yeah, doctor, when it comes to the successful surgery you just had, it was a really great achievement, but mostly doctors and patients, they prefer to prevent the disease or the cause before it happens. So when we go to gland stones, what are the causes of gland stones and how we can prevent it and how we can detect it early? Do you advise us to detect it early, or there's any way we can detect gland stones as early as possible?
Yeah, actually the formation of the stones itself, unknown. But there is risk factors for it, which means there is some things, it will lead to the stone formation, for example, you know, if the patient is drinking a lot of fluids, especially during summertime, this is one option. And also there is cases with the deficiency with vitamin D. This vitamin D, you know, because our community always, they have this problem, this will associated with parathyroid hormone. There is small glands also in the neck, they name it as a parathyroid glands, produce this hormone. So the hormone will be high because of vitamin D deficiency. Parathyroid hormone can also form stones in the kidneys, in the submandibular glands. So this is, we ask to correct vitamin D, take it seriously, and also always drink plenty of water. And also there is risk factors from medications and many things. You know, those medications, this is not in our hands because the patient he should receive his medications.
Definitely.
Side effects.
So, doctor, with this great achievement, what do you think like the medical society will get, how it will help the medical society in the future?
Yeah, this is a good question because, you know, in the future or now, because, you know, as we mentioned before during our interview now, the endoscopy, this is a new technique and still is growing up, and FDA approved in 2005 and need specialized trained people, and not all the centers among the world they have those specialty and also trained people on those scopes. And also the scopes is really costly, reaching I think with the instruments $40,000, and you have to buy many of them because it's fragile. You know, the diameter of the scope is 0.8 millimeter.
Wow.
Really
Which is
small.
really fine.
Yeah.
So you should deal with it gently.
Exactly.
So that's why now in this surgery, ultrasound is available mostly among the world.
That's right.
And you can use the small needles, localize it by ultrasound, and minimize your incision. You can remove stones, and you can preserve the gland. Don't remove it. This is why this surgery, inshallah, in the future will help others, even in advanced countries or in other countries.
Exactly, and I think that makes it very accessible, as you said, with the ultrasound. It's available to most clinics, I'm guessing. So that's really great. So you talked about not wanting to remove the parotid glands. So what are the functions and what is the importance of this gland?
The glands, salivary glands, as we mentioned. Now, one of the importance now I'm talking.
Yes.
Because give lubrication for the mouth, so saliva will be in your mouth. That helping me now when I'm talking, because lubrication of your tongue, your teeth, and also it will prevent the decay of the tooth.
Exactly.
And also, you know, one of the function of salivary glands is assessing the foods when you are eating, you know. So when you remove the glands, you have to be careful. Other glands will work, try to adapt, but you know, it will decrease the salivary production.
Yes.
Exactly.
Definitely. Well, doctor, I think this is a very important invention, and hopefully a lot of people will be able to use it very soon with your help. But are you planning to standardize this innovative method of treatment, we can say, with the proper medical organizations and even other communities in the future?
Yeah, this is, there is steps should be done, and those steps was started nowadays. I have a group with me now, Kuwaiti doctors. We will start to report it as a new case and as a new technique and as a rare case.
Yes.
So we have two things in this case, and inshallah we will publish it in international medical websites and
Yes.
research and all those issues as a first case was reported in this technique.
Yeah. Dr. Mishal, please tell us more about the tips. We are searching for tips and prevention for the treatment when it comes to parotid glands. Like, is there any way to prevent it and to avoid also complications at the future?
Yeah, this is we mentioned it, which is the drink waters and avoid or correct the vitamin D deficiencies. This is one of the things we have to prevent.
Yeah, and especially during the summer.
Exactly, exactly. But let's say in case of the parotid removal, there is might be complication happen after surgery. This is maybe, yeah.
Yes.
Facial nerve is the important part on the surgery or during the surgery. So if you plan to remove the whole gland, you should think about the facial nerve.
Yes.
Yeah, this is very important things.
Yeah. And doctor, what is the most important complications of a parotid gland resection? Sorry, the most.
Yeah, we mentioned in intra-op, inside the operation itself, there might be, you will injure the facial nerve, but this also, there is machine will help you. They name it as a facial nerve monitor. It's an electrical machine.
Yes.
You can put it in the face and this will detect any movement or anything touching the facial nerve. And also, there is vessels, bleeding. It can happen during surgery. You can control it, but we have to be careful. And also the cosmetic issues. I'm always thinking about cosmesis in those patients because, this is an exposed part of the on the face and,
Exactly, it's a big deal. The face is the
Exactly.
first thing you see when you meet someone. When it's on the body, clothes can hide it. So it's a great thing that you're really focusing on the plastic surgery, maybe part of it, like adding them together, right?
And not only as a plastic surgeon, because we are a human.
Yes.
Now some people, they complain from acne, which is small things. But now
Exactly.
imagine you have a big scar on your face.
Exactly.
That's right.
You will try all your best to remove it, but
It's not
Exactly.
possible.
yeah. So it's a matter of a human and feeling.
Definitely.
Don't think just this patient. No, this is a human. In the future, you have to think about his future.
Definitely.
Exactly.
Well, thank you so much, Dr. Mishal, for the valuable information you shared with us, and congratulations again with your big achievement. And be sure, all of us are proud of you because of your achievement, and we wish you the best of luck with your future endeavors.
Thank you. Really, thank you.
Thank you
Thanks
so
a lot.
much,
Thank you.
Doctor. It was our absolute pleasure. And of course, good luck. We can't wait to see this procedure being used worldwide.
Thanks
Thank
a
you.
lot. Thank you.
Dear viewers, we had with us Dr. Mishal AlMutairi, consultant, otolaryngology, head and neck oncology surgery. And up next, we have a report on horse riding. Stay tuned.